Piece in the Globe and Mail this week that got a lot of attention, where essentially you made this argument that Canada should reconsider its vaccine mandates for travelers. Why are you arguing this?
Yeah, so first of all, look, I've been on CBC and with others many times talking about the benefits of vaccination. It's still there, and these vaccines do an incredible job with preventing people from getting seriously ill with COVID. They're a part of our pandemic strategy moving forward. But the justification for vaccine mandates on planes and trains was that they would reduce transmission to a level to keep them safer. And that may have been true in the Alpha era, the Delta era, but things rapidly changed with Omicron. We know 2 doses of vaccines over time essentially has 0% efficacy at preventing or at infection, symptomatic infection. 3 doses even over a set amount of time loses quite a bit of effectiveness, and data from the United Kingdom suggesting even at 20 weeks, the same loss of protection against symptomatic infection. And so, the mandate really tried to separate people who are at low risk of transmission and put them together with people at low risk of transmission really doesn't hold. We have a lot of people that have gotten Omicron, especially that 10% of individuals that were unvaccinated, also having some protection against COVID-19 from natural immunity. And again, noting that the person sitting beside you could have had their second dose a year ago, could have had a single dose of Johnson & Johnson, could have been an 11-year-old or less that doesn't have to be vaccinated for that flight, really is starting to break down how much this is protecting people while traveling, and understanding it's not a without consequence policy. There are people that cannot get on a domestic flight. There are people that cannot get on a domestic train to see a loved one, to see a family member, to go to a rite of passage for employment reasons, etc. We really have to start putting this back on the table for people to have access.
Forgive me for interrupting, because you know that people are watching at home and they're getting upset because the argument and the pushback to you will be, look, better safe than sorry. Most of us went and got our 2 doses. Some of us got our 3rd dose. Why do we have to go through these steps for the greater good and others don't, and they'll get to enjoy the same travel opportunities or access that those who feel that they acted quite responsibly did as well?
Those people who got 2-3 doses of vaccines, they've done the right thing to protect themselves against the disease, from the severe complications of this disease. But, it's still something to be said that people lose their rights for something that, again, is not necessarily offering a significant protection for that individual aircraft or train. And again, if these policies don't hold, we have to also be truthful to society. We also have to take away some of these restrictions in order for us to judge the gap. And again, this isn't just in airplane travel and planes. We are having restaurants across the country where people can interact despite their vaccine status. We've seen the playoffs where people are, again, in massive crowds, where, again, vaccination does not account for things. And so, again, I think most provincial public health units have recognized that vaccine mandates are not an effective strategy to prevent transmission. And so we do need to take that to the federal level, as it is affecting people one way or another, and reflecting that, we do have to get through this pandemic together as a total population, not just as ones that chose to get a vaccine.
Many have argued that keeping the mandate in place actually incentivizes getting vaccinated.
Yeah, I mean, I think there was some justification for this back in August and September when people may have needed a bit of impetus. It's still, very hard because you want to make sure people get vaccinated on their own terms. You don't want to necessarily push them against the wall to get vaccinated. Again, if we need another vaccine down the line, if there's a newer series of vaccines, we really want people to buy in. But it's also important to know, November 30th was the last day that people could travel with a test or a vaccine. Since then to now, there has been 3% of the Canadian population that has gotten vaccinated in that interim. And again, we can't all blame that or give that to travel. It could be for a number of other reasons that 3% decided to get vaccinated. So, again, I think this has probably hit a wall in terms of what it can provide in terms of getting people vaccinated. people have gotten Omicron and disproportionately in that unvaccinated group, which counts as a vaccine based on even data from here in Canada. And so, again, that everyone is starting to get on even ground now in terms of immunity. We really do have to recognize that as part of these rules.
Dr. Chagla, your article has been met with several responses, but two strong ones are, this is great. Finally, someone is taking a rational approach to this. There's been voices applauding you for that. And then, of course, as you know, there are voices who are saying this is irresponsible. We're still in the middle of this pandemic. People are still getting sick, still dying. Don't remove any restrictions, particularly ones that we're getting used to. That's some of what we've been hearing. Tell me about the response you're getting.
Yeah, I think it's that, obviously this is a polarized issue. It goes back to many different issues that have ongoing over the last few months. Look, it's not a comfortable position to write in. It wasn't an article that I think a lot of people embraced. But at the same time, there were a lot of advocates in September and October about imposing proof of vaccination and arguing that it had, benefits. No one is sitting here at the other end arguing once proof of vaccination became less effective and, in fact, probably not effective significantly, that they should be scrapped. And really, again, it's that part of being a public, health person, understanding the data, being transparent and honest is, recognizing when our limitations are there for our policies and talking about it honestly and openly to have a discussion in order to actually make sure that we make policies that make sense rather than make policies that are punitive without a benefit.
Well, we've been talking with you as an infectious disease specialist about COVID from day one. Here we are more than 2 years later, perhaps getting to the other side of this pandemic. But Dr. Zain Chagla, it's a fascinating argument you're making. Thank you so much for joining us tonight.
No problem.